Hi, and welcome to another episode of Smile Dr. Darwin. This is Ask Dr. Darwin, hashtag Ask Dr. Darwin. In today's episode, we're going to be talking with student Dr. Nmandi, who's a third-year dental student here at Rutgers. We're at beautiful Rutgers University School of Medicine. We're going to be talking to him about some strategies and tips and getting into oral surgery. This is his passion. This is the thing that he wants to do. And I think we first linked up, probably about, it's been about 3 or 4 months?
Yeah, about 4 months.
About 4 months ago. And how did we meet? I forgot how we even met, too.
It was through one of my colleagues, Michael Israel.
Michael Israel,
president of Student Dental Network.
That's right.
I think he sent out a link with your name or something about you for the Student National Dental Association.
Yep.
And I watched a couple of your videos, and I found them very, very educative and informative, especially for dental students that were in my stage thinking of what next after dental school.
Okay.
That's a very nervous, wrecking, confusing, mixed feeling stage. You preoccupied with your requirements for dental school, your clinical requirements,
right,
trying to make sure your grade points and your ranking in school stays up. And at the same time, you're thinking like you need to act fast now in preparation for what next after dental school.
So tell me a little bit, tell us a little bit about your decision to go to become an oral surgeon. Like, at what stage did you know you wanted to become an oral surgeon?
Okay. Personally, I'd always wanted to become an oral surgeon because I've always loved the concept of trauma. I originated from a country where I saw a lot of trauma, and management of head and neck trauma was an intriguing factor to me. I was always perplexed by the complexity of the head and neck. So that's greatly attracted me into the field of oral surgery. So I started working towards that. I would ask questions. I found that first, to become an oral surgeon, you needed to be a dentist.
Right.
The first step was to become a dentist.
Dentist first.
Get your license to become a general dentist, and then a specialization training. So I thought about it for some time, and I decided to give it a shot. And I have enjoyed every step of the way up till now. Every part of dental school, from head and neck anatomy to sometimes volunteering in the hospital, seeing things and asking myself, is this what you really want to do? Like seeing trauma cases, seeing lacerations, and seeing tumor and cancers. In this part of the world, most people don't talk a lot about head and neck cancers, but those are really big issues that we need to talk about.
So you knew going into dental school, it sounds like that you were interested in trauma, you're interested in things in the head and neck. What did you have a science background?
Yes, I did. I've always had a science background.
Okay.
From scratch, I'd never fared well in arts.
Okay.
I struggled a bit in arts, even though politics in society, human things I could discuss with you, but in terms of sitting down to study arts was never a flair for me. I was more intrigued in science. How do things work?
Right.
How the creation of things, how did things come into existence? So science has always been a very background, has been like a basic part of my life in terms of I always wanted to know how do things work, how are things created, put together.
I got you.
So science has always been that intriguing. But then gradually I started moving towards human science. I wanted to know, how does the body work? Mm-hmm. How does the human body? It's so complex, but there's got to be a way in which this complex system functions. Mm-hmm. So that's how I zeroed into human science.
So tip number one is you have to have a really strong, not necessarily a strong interest, but probably a strong interest in human science as relates to body functions and head and neck for oral surgery, right?
Yes.
You would say that? So you got here in dental school. You're now into your third year dental school. What things have you done here at Rutgers or in dental school that have been preparing you for applying to oral surgery? Talk a little bit about that, like things that you've done course-wise, whether extracurricular, networking. What things have you been doing?
Because of the competitive nature of the field of oral surgery
very competitive. Yes.
Now, you're not just going to rely on your natural being. You're going to put some extra effort, go the extra mile. And from the regular things I do in dental school, from preclinical courses up to now that I'm in the clinical stage of my program, I have always first, you have to show your interest in oral surgery. You have to make the faculty.
How do you do that?
You have to take your oral surgery rotations very seriously.
Okay.
You have to perform very well in your oral surgery didactic courses.
Right.
You have to show your faculty that you're interested in that field for them to pick up, to reciprocate the interest. Because when they see a student interested in a field, they return that interest, ask you questions, I had a faculty walk up to me and say, do I need a mentor? She's ready to mentor me. That she sees that I'm very, very interested in oral surgery. During my oral surgery clinical rotations, I would be the first student in, last student out. Okay. Always the first student in, last student out. Any student was like, I can't do this, or I'm too tired, I would volunteer. Even during my lunchtime, the residents would be like, we need extra help.
And you would volunteer?
I would volunteer, miss my lunchtime, because it's what I'm interested in, it's what I love doing. So lunch was insignificant compared to doing what I love to do.
So tip number 2 is make sure you involve yourself in all things that are in that specialty area. So for oral surgery, whether it be volunteering, whether it's a seminar, a class, getting to know professors, and especially that rotation that you're going to be doing, you need to be thoroughly immersed in that rotation so that the professors know that you have an interest and be interested in learning from them. I think that would probably be...
They want to see that interest, that you're interested in that field. And when they speak up that, or when they sense that interest in you, they reciprocate by teaching you, by bringing you closer, trying to explain to you like, okay, this is what the field entails. It encompasses not just the head and neck, but the whole human body. So you have to be good in your medical knowledge, not just your dental knowledge now, but very sound medical background. You have to know everything because
anatomy, physiology.
You'll be managing a patient just the same way a general surgeon will be managing a patient. No difference.
Okay.
And other things you need to do are like externship. You need to make sure you go for externships. You look for hospitals, apply for externship programs.
So here at Rutgers, when do the students, or when do you as a student start to apply for those types of externships?
The sooner the better. I would usually advise people at the end of your sophomore year, between your sophomore year and your junior year.
So D2 year and D3 year, you should be looking at externships that are within the school as relates to those given specialties. So we're talking about oral surgery right now. So you need to be on the track of getting an externship and applying for those programs. Find out who the person is who's in charge of the externship, and that's the person, he or she or he, whatever it is, whoever it is, that's the person you need to start making a contact with. Now, one of the things I remember you sharing with me at one time, and it might have been the first time we talked, was the fact that you had some discouragement about applying to oral surgery. And for whatever reason, where it came from, who it came from. Tell us a little bit about what happened and how you decided to go above and beyond that discouragement.
Okay, first I'm going to say thank you to Dr. Darwin. You played a very crucial role in helping me to cement my decision to go into oral surgery. Like in everything in life, you get to see a lot of naysayers, a lot of people that object, a lot of people that doubt, a lot of people that...
A lot of haters. Yeah, a lot of haters. There's haters in dentistry too.
A lot of people that will discourage you, but my advice, what I did was ask a lot of questions. Go far and beyond. Don't just keep yourself within that niche, that local, that small place. Go outside. Speak to practitioners. Oral surgeons. I spoke to oral surgeons outside my school.
Good.
So I didn't just speak to the faculty guys, the oral surgery faculty or non-oral surgery faculties. I decided to speak to oral surgeons outside in the field. Right. Because the major excuse most people that try to discourage me from the profession.
What did they say? What
was socioeconomic factors that because the way dentistry was moving, general dentists were encroaching into almost every field, and the bread and butter of oral surgery was third molars and implants, and that general dentists are doing that too. So you'll be left to do nothing.
So he got discouragement based on older OMFSs or oral surgeon, oral maxillofacial surgeons saying, "Hey, the general dentists are coming into this area just like they are with ortho, just like they are with endo. They're coming into certain parts of the oral surgery discipline, and they're doing it. They're placing implants. They're taking out teeth. They're doing bone grafts. Probably not too many Lafort fractures and stuff like that.
But just to correct a bit, it wasn't just oral surgery faculties alone. Non-oral surgery faculties too. We're also on that same thing, like
saying, don't go into oral surgery because as a general dentist, you're going to be doing a lot or some of the things that the oral surgeon is going to do.
What's the point in that you're going to, and you end up having to do nothing because you'll be competing with general dentists for a few procedures. So I decided to speak to oral surgeons outside the private practice, and I was surprised when I heard that oral surgeons out in the practice. I actually had a visiting faculty. He comes like once or twice a year to lectures, and I was grateful that I was in class the day he came to lectures, and he told me, like, in terms of socioeconomic reasons, that he could even decide to work only 3 days in a week and make more than any other general dentist around him. That it's challenging in the sense nothing good in life comes easy, but if you work hard, run your practice very well, you'll be successful financially. But you shouldn't just look at the profession as financial returns. You should look at gratitude. Are you happy with what you're doing?
And maybe are you happy with changing people's lives? Especially with oral surgery. I mean, there's outside of the implants and getting people out of pain, some of the things that you guys will be, some of the things that you will be dealing with are, cancerous tumors, head and neck, surgeries,
and that's
traumas.
one of my interests. It's cancer, head and neck cancers, as well as trauma. I love trauma. I'm in the military, U.S. Army, and I think if I could equip myself properly in trauma, head and neck trauma management, I would play a huge role in the United States Army. So
that's a good, that's a good plan, man. So the other tip is do away with the naysayers. If you have naysayers right here in your ear, you need to move your ear away or get yourself away from that naysayer talk and go out and meet other people. Meet other oral surgeons that have a different perspective, because that one person that's in your ear, they could be saying those things because maybe of their experience, maybe something that they did, they failed in and were not very successful. So now they're going to tell everybody else, don't go into oral surgery, or as a general dentist, you'll be doing the same stuff. So broaden your horizons. Make sure you get perspectives from different people that are also in the profession or in that specialty niche. So you were able to kind of override the naysayers. Now you're in your third year. You're finishing up. And one of the seminars that we just got out of deals with preparing for life after dental school, which is advanced dental education. And in student Dr. Nmadi's, in his perspective, he wants to be a specialist. So after dental school, you have the specialty programs, and that's what today's program and seminar was about. It's about different options as far as general practice residencies, but also how to attack and get through the PASS, which is the post-graduate application service documents. So that's where you are now.
Yes.
The third year, you're finishing up. Now it starts the whole application process. So one of the things that's unique about oral surgery, and one of the things that they've done that you guys have to know about as you're applying, oral surgery has changed a little bit as far as the application process, primarily because there have been some dental schools that have changed how they report or how they grade and pretty much reveal a GPA. There's a lot of schools now that don't give out GPAs. Yeah. There are a lot of schools that just do pass-fail, trying to follow the medical model. So tools that program directors for oral surgery programs, also for endo, and also for pedo, and also for ortho. Those are the four most popular programs, specialty programs. Tools that they would use to kind of see who's going to get an interview, they can't use anymore. They can't use GPAs because some schools don't do GPAs. They can't use some of the board scores because now even the board scores, the national board scores, are pass fail. There is no number. There is no numerical value. It's just pass or fail. So two of the things that they were using as key components to allow them to kind of say, all right, I got a pile of applications here. I'm going to be able to sift through those. The ones that don't have a GPA that I want or don't have a board score that I want, I'm going to put over here. All the other ones I'm going to put here, and then those are the ones we're going to interview. Now, they can't do that. So one of the things that how the game has changed with oral surgery is now they have another board exam, and it's a board exam that's used for medical students. So I want you to talk a little bit about that and preparing for that, because I have current residents now that are like yourself applying to oral surgery, and that seems to be the one thing that's causing some of them some obstacles. So could you kind of talk about, tell us a little bit about this this exam that's on the medical model that a lot of programs are using?
Well, the exam is a MBME CBSE, and that's a long acronym.
MBNE, what does it stand for? It stands for
National Board Medical Examination, and then the CBSE is Comprehensive Basic Science Examination. It's very similar to the United States medical licensing exam, step 1, the same exam the medical students take at the end of, I think, somewhere in the second year medical school. It's the same questions, it's just a shorter version.
Right, and from what I understand, the oral surgeons had them create this exam that we're talking about specifically for oral surgery, which is unprecedented. That had never been done before. So it's serious. You guys have to understand how this game has changed for oral surgery as it pertains to you applying. So now there's a new board. There's a new board exam that if you're applying to oral surgery that you've got to take. And you've got to do very well. Because if you do, then that pretty much will write your ticket.
Yes, exactly.
To program.
Like you said, it guarantees you an entry into one of the oral surgery residency programs. It's a challenging exam. I wouldn't say hard, but it's an intense exam.
How do you prepare for something like that? Tell us a little bit about what you found and what you're doing in preparation for it.
The first preparation you need to do is you need to remember all you have learned in your freshman and sophomore year. And you need to remember your anatomy, biochemistry, physiology. Yeah. Because the exam is really not about dentistry anymore. No. It's a test of your medical knowledge. And
so if that's the case, and here I'm just thinking about something for you guys, for us. If that's the case, that means you should probably take that exam after your second year of dental school.
Definitely. I would advise
you can't wait until...
Yeah, on the website it says you could take it anytime in dental school. You could even take it in your freshman year, but I would advise right after your sophomore year, take the exam. Tip number 4,
when you're applying to oral surgery, you're taking the National Board of Medical Examiners CBSE exam, right? Clinical Basic Science exam. When you're doing that, don't wait till your 4th year, your D4 year. Don't even wait till when you are in residency. All right? Like if you're in a GPR and you decide you want to do oral surgery. Why? Because what he just said, a lot of the material is based off of your first and second year of dental school. So if anything, by the end of your second year, that's when you want to be taking this exam.
When your pharmacology, your anatomy, physiology, biochemistry is still fresh in you.
And all that stuff's on the exam.
Yeah, all that stuff, it's clinical. Ooh. It's the clinical aspect, like the medical clinical aspect of those subjects. They're not going to ask you what nerve runs through this person. They're going to ask you medical conditions that relate to that nerve. So you need to know that nerve. You need to know your histology, your pathophysiology. You need to know how the body functions. One of the questions will be like the the female reproductive system in terms of like they want you to have a knowledge of the epithelium prior to development of cervical cancer and what epithelial transition occurs after the patient develops cervical cancer. Now, that means they're trying to draw your knowledge of histopathology.
Mm-hmm.
So it's purely then, they like some other questions ask you about the different trimesters, what occurs during the development from fertilization down to like delivery.
So no dental anatomy.
It's your dental. No one is going to ask you a pure dental anatomy.
No, I mean on this exam that we're talking about.
No one's going to ask you what nerve runs through your. We're going to ask you if a patient develops maybe like parotid gland infection or parotid gland tumor, which nerves, which branches of the facial nerve, or what branches of what nerve, or what lesions do you see?
So if that's the case, how have you gone about studying for this, and what's been your plan?
My plan, I took the exam like about a month ago, and the materials I would advise anyone to go with is still Pathoma. There's a very good textbook for pathological review. It's called Pathoma.
Pathoma?
Yeah, Pathoma.
So tip number 5, when you're applying and taking this exam and you're preparing for the exam, get this textbook. What is it called?
Pathoma.
Pathoma.
So I want you to take the USMLE First Aid revision. It's very good. It's a quick guide. It doesn't go into details. It's on premise that you already have a knowledge of what you're studying. So the first aid is very good. And then question banks.
Banks. Use the question banks.
You don't want to go into an exam and then you've prepared so well, but because you really don't know how
they're going to ask the question.
Yeah, so how they're going to ask the question. You get thrown off base completely.
Yeah.
So you question banks. I think it consists about 2,000 questions. You need to make sure.
How much is that usually, man?
I think about $200 or something.
So question banks, just like when you are taking the DAT and you're actually taking part 1 and part 2 of boards, we used to have this thing called dental decks.
Yes.
And they still may have it, but I think it might have a different version now.
There is a hard copy and then there's an electronic copy of the dental decks. So most of the tech, like the Pathoma First Aid and the Pathoma and First Aid have hard copies. And they also have soft copies. But the U-Word question banks are purely online.
Okay.
You have to like register for it and then for a time frame.
Okay.
Yeah.
So you want to get the question banks, help you to kind of study and prepare for. Now, how many times a year is the exam?
Twice. The exam is twice a year between the months of March and April, and then between July and August.
Okay. And then so two times a year, and then you have the whole notion of the exam as relates to the score.
Yes.
And what we talked about before was how important your score is, because that where you are in that range of that score will determine whether or not program directors are going to be pulling you out to interview you or leaving you there to fall like that, meaning you're not getting an interview. So what's the range, like the score? What's the score? The ideal score to have?
There isn't an ideal score to be factual with you. There's just an average in which most people would say if you want to be guaranteed of an interview, you should be getting probably late 50s, like 56, 57.
So 60 is a good score.
60
it's a little bit higher than average score.
Slightly, very slightly. Or you would want to put it within the average range. If you get an 80, 90, definitely, like you'd be top choice in any school, any program you apply to. Yeah, but like your aim should be like late 50s.
So mid 50s?
Mid 50s.
So mid 50s is an average score. Anything lower than that?
And people have actually gotten accepted with like 45, but you don't want to like take that chances. You don't want to bank on the fact like hoping that yeah. So you want to be in a comfortable position.
And I'm sure also those that had a lower score, lower than 50 or 55, they probably had something else on their resume or their personal statement, how they talk, how they interacted with during the interview. So I think that probably has something to do with it.
That has a whole lot to do with it. Like your research background, how much volunteering you have done, how much externship you have done, how much can you prove to them that you're interested in that profession, not just for the love of the profession, but like how much you're ready to sacrifice for that profession.
So tell us. So the last part is kind of telling us where you're going from here. Like, what's your strategy moving forward? Now that we've got to this point, you've taken the exam once. You're probably gonna take it again, I guess, in the fall or something.
Yes, I then take it again in July, just to increase my chances of getting into a program to get a much higher score. It's it's unlimited how many times you can take the exam. So I just want to make myself more competitive.
Of course. The higher the score, the higher the possibilities
of you getting into a program. So my next goal is to start applying to programs. I'm not going to wait till I take the exam in July before I start applying for programs.
Right.
I'm going to apply to as much programs as possible.
Right, and some of those programs will probably ask if you've taken the exam or what the score.
Most programs will ask if you've taken the exams and your score, because they're trying to filter out the amount of applications they have, streamline the amount of people they're going to call for interviews. So most programs will ask whether you took the exam and what your score is. But the good thing about it is that program deadlines, I think the earliest deadline is in August. Mm-hmm. So this exam is in July. So you could actually send in your applications now, start as soon as the Pass and Match program opens up in May, send in your applications, hoping that by July you take the exam and you get a good score to support your application.
So for you, it sounds like you've got a plan of action, and we talked about this before, a little bit before, about applying to oral surgery programs, but maybe even applying to GPR programs,
yes,
which might be a strategy.
You always want to have the backup. You always want to have something to fall back to. I would advise, if you're so interested in oral surgery, but you want to have a plan B or an alternative, not because you're not fully sure of what you want to do, but just in case you don't get into an oral surgery program immediately. You want to get into something to show that you're still interested in learning, that academic sense. So applying to a GPR program, and just like you told me, look for programs that have strong oral surgery basis. That helps you develop your oral surgery skills, and that also explains to whoever gets to interview you the next time you apply for an oral surgery program that, yes, you're interested in oral surgery program and this is what you did. So some people actually go for what's called non-categorical internship program in oral surgery.
Yes.
Yeah, but some other people apply for a GPR program. Yes. A GPR program, because for you to be a good oral surgeon, you have to be a good general dentist. That's how I see it.
That's right.
If you're going to do that orthodontic surgery, you have to know what a good occlusion looks like.
Right.
You have to know
and be able to communicate that with the restoring dentist.
You have to, exactly. If you're going to place an implant, you have to know how that implant is going to be restored. So you can't tell me you're a very good oral surgeon if you are not a good general dentist.
Right.
So my advice is, while you're applying for oral surgery programs, you can apply to general dentist program as a backup. It's no harm.
And I have had some candidates. We have had some candidates that have done that. I think I told you about one.
You did.
That apply to oral surgery and GPR. And quite honestly, there are some programs that actually want you to do a GPR.
Yes,
they encourage you to do a GPR, and that's just not oral surgery. That's also for ortho. Not ortho.
Pediatric dentistry.
Pediatric dentistry, definitely. They encourage that. They want you to have that extra year. So it sounds like your plan is apply to oral surgery, also apply GPR, which is good. I would continue to focus on GPR programs that do have some above average content and experience in oral surgery. Extractions, being on call. That's another thing why I would recommend a GPR versus an AEGD, because the GPR, you're going to be on call, you're going to have hospital call, you're going to be on rounds with them, and you're going to have the opportunity doing your oral surgery rotations at whatever program that you're looking at for GPR, that you're going to have a chance to go to the operating room.
Yes.
And everything. So all that is a strategy so that you can not only learn, but it's getting you in the next step to that pathway of you becoming a board certified oral surgeon, and it puts you in the confines of oral surgeons. That are going to be at some point are going to be sources for your letters of
recommendations. I always say this: no matter which wherever you find yourself, learn something. So even if you're doing a GPR residency program and you're with oral surgeons, learn something from them, because your ultimate goal is to get into oral surgery. When you get into oral surgery, you're already you're not a fresh out of dental school resident. You would be a resident with a lot of experience. You would be you would be a resident in which the chairman of your program feels at ease when he's at home, knowing that you're on call tonight, knowing that there's a good intern or a good first year resident that's on call tonight. So we know he could do the basic minimum and stabilize that patient till the morning when the whole team is around.
Yep. And you just something you said made me think about it. Another part of this strategy also is you apply, say you get into a GPR program, and then the following year you apply to oral surgery. Another additional route is some people will go ahead and they will do an internship. They'll do a GPR, then they'll do a 1-year internship or 1-year internship, apply to oral surgery, and then with the hopes of that internship, they'll wherever they do it at, they'll be picked up. Either at that institution or maybe at some other institutions that they're applying
all
for.
that is building your qualifications.
That's right.
You're interested. You're qualified.
That's right.
Because if someone has a good score, has done a GPR, an internship, or both, you are a very good candidate. You are a very qualified candidate for any program.
So that's good. So looks like you're on your way, man.
Well, I'm just going to keep working hard. I hope I get what I have always been dreaming of. I just want to be an oral surgeon, trauma, head and neck cancer, work with the United States Army, and so I hope.
Got an idea? I don't know. You might have thought this already.
Yes, I have always.
About the Army?
Yes, I love the United States Army. I love to serve, and I hope someday I'm an oral surgeon. I hope soon I become an oral surgeon in USSA.
Well, I was saying that to say that as a dentist, they have oral surgery residency programs
too.
Do.
The United States Army and United States military have oral surgery programs. The only clause is that you have to be an active duty soldier.
That's all right. I was active duty for 4 years in the Air Force as a dentist, and one of the things, like all the other military outfits, they encourage you to stay in, but they also encourage you to stay in, but also to specialize.
Specialize, yes.
And usually, pros, endo, or surgery are the ones that they find hard to keep people in because the potential for income and lifestyle is much bigger on the outside. But you can work that to your advantage in the sense that you're already in the service right now. Was National Guard. And usually, sometimes in dental school you can apply for some of these health professional scholarships through the Air Force or Navy or Army. But that I would leave that open too.
I haven't closed any doors.
Especially now that you're applying for going into your 4th year, D4 year, applying to be active duty in the Army as a dentist, who's also eventually wants to be an oral surgeon. Let Uncle Sam pay for it, get your training.
No, but you get very good training. I know you get very good training.
Absolutely.
And then you don't get to worry about things like malpractice insurance and the other things you worry on the civilian side. You get very good training.
But and I'm saying that's another strategy to get to the end of what you're trying to get to.
You're right.
But I would leave that open as relates to, even direct ascension, active duty, doing a GPR in the Army, and then apply for oral surgery. So I would look at some of those programs too.
Well, that's something I've been trying to tell my fellow classmates or colleagues interested in the oral surgery field too. I've been trying to share the information about how to go about this, the whole thing. Let's spread our tentacles, let's work hard, and we'll get to where we want to get. And I'm very grateful for my oral surgery faculty over here.
That's good.
Program chairman.
That's good.
It's been very wonderful and helpful, and most of the faculty members, I must commend them, and I must say thank you. You helped me in a very, very crucial period when I knew what I wanted, but I just needed to And I'm happy I experienced that because it actually made me appreciate my decision to go into oral surgery more. It made me like, this is actually what I want to do.
Yeah.
Yeah. So, and I really am grateful. That's how we met. And
yeah. It was a reconfirmation
exactly.
for you that this is what I want to do. I don't care about the next
step. My age and everything, like my circumstances, and I was like, okay, like I'm not like the traditional student. So, and I'm like, okay, like I needed to put everything.
That's an advantage.
And I'm like, oh,
that's an advantage.
This is what I want to do, and I'm going for it.
Yeah, man, go for it. Hey, age is just a number. You on the right track, man. You on the right track, and we're gonna continue to kind of follow your process.
I really want to like work with you to mentor featured students.
Yeah.
Students. Like I really want to work with you. I really want to like learn from you, like mentoring future dental students and guiding, and because most people out there really need guidance.
Yeah, man. They need somebody to talk to. They need to have some exchange. They need to get a different viewpoint, a different perspective, which is sometimes kind of hard here in these walls in the school. But still, and that's one thing that's important about, and this is like the fifth or sixth tip, which is networking. That's why networking is so important, because you get viewpoints from other people that are outside of your environment, and you need that because other people outside of your environment have different experiences, or they have experiences that they can share with you and tell you about the process that you're going through, like the process that he's going through. One of the things that I've always have maintained is contacts with friends, colleagues, not just general dentists, but they're specialists too.
Yeah.
And it all started in dental school, SNDA, different organized dentistry groups. And even right now, as we speak, I know there's at least about 5 oral surgeons in our new dentist development network. This new dentist development network that we have, that you could call. I give you the number, you can call, and they're going to talk to you as if you guys had known each other for 10, 15 years.
That's
and that's key.
That's
helpful, man. Because they'll tell you a little bit about the profession. They'll tell you, some of them have just finished oral surgery programs. Some of them are in the oral surgery programs at school right now. And some have taught and are faculty in oral surgery programs. So you got 3 layers of feedback. That's all because of networking and staying in contact and networking with people. So we want to thank student Dr. Nmandi here today. I said it right?
You did. Yeah. That's okay. You did. I'm
not even going to try his last name. I'm going to be jacking it up. Oh, my goodness. But we thank you, man. Thanks for your time and sharing this. This is going to be helpful for a lot of people that we mentor, that we kind of talk to and give tips and strategies on. Actually, oral surgery to date right now, all the videos and stuff that we've put up here, oral surgery is the one that's been the most popular.
Oh, interesting. Which video was that?
The one that you and I did about how to apply to oral surgery, or how to get into oral surgery residency.
That's very good.
Actually, I think it was part of the first video that we did.
That was the first
that one has gotten the most visits. And if you guys haven't seen that one yet, you need to flip through this YouTube channel and find that video on how to, I forgot what it was, how to get into oral surgery or something like that. You know what I'm going to do? I'm going to post it right there. All right, right by the end of my pen mark right there. It's going to go right there so that you guys can see it. The link to that video right there. And that's been helpful. So this one here is I think this one is 10 times better, because it's actually practical knowledge and information that you can use, that someone else is going to be using as you're using it for your process too.
My advice is just keep asking questions. Just keep asking questions.
Tip 6. Tip 7. Keep asking questions.
Keep asking. Never stop asking questions.
Good. All right. So if you guys have any more questions, or have any questions in general about dental residency programs, about how to get into dental school, even for some of those that have questions about dental procedures, this is the time. You can always contact me at newdentistcoach@gmail.com. We're going to put that right over there somewhere. New Dentist Coach, or we might put it right there. I don't know. newdentistcoach@gmail.com. Ask me your questions. We're going to be doing more of these interviews and tips and strategy informational sessions so we can help you. Help me help you. All right? Thanks again, man.
You're welcome.
Thanks for your time.
Thank you so
now
much.
it's back to studying, huh?
Yes, back to studying, back to the grind.
Back to the grind. All right, guys. See you later. Have a good one. Bye.